Hello and welcome to the Amplifying Scientific Innovation podcast. I'm your host, Dr. Sophia Onye, founder and CEO of the Sophia Consulting Firm, a life science marketing and communications consultancy that was established in New York City with the goal of amplifying scientific innovation. The goal of this podcast is to showcase scientific innovations stemming from global life science companies through conversations with senior leaders who share their unique leadership journey, corporate vision, and industry outlook. My guest today is Dr. Sophia Yan, CEO and co-founder of Pandia Health, a health technology company that is partnering with pharmacies and women's health experts to make women's lives easier by providing a one-stop shop for recurring medications, starting with birth control. Dr. Sophia obtained a Bachelor of Science degree in biology from MIT. She holds a Doctor of Medicine degree from the University of California, San Francisco, UCF School of Medicine. She completed a pediatrics residency at the Children's Hospital of Oakland and returned to UCSF for an adolescent medicine fellowship. As if that's not impressive enough, Dr. Sophia holds an MPH in maternal and child health from UC Berkeley. Sophia is a clinical associate professor at the Stanford University School of Medicine and executive committee member for the section on adolescent health for the American Academy of Pediatrics. And her passion for making women's lives easier is further showcased by the fact that she's a co-founder and board president for sheheroes.org and founder of the Silver Ribbon Campaign to Trust Women. Now, my namesake, Dr. Sophia, and I connected on LinkedIn based on our shared love of the name Sophia, similar professional backgrounds, and mutual interest in advancing women's health all over the world. And now, for the first time, I am happy to say, welcome to the show, Dr. Sophia.
Thank you, Dr. Sophia, for having me. I think this is probably one of your best shows ever with two Dr. Sophia or Dr. Sophia squared.
There you go. That's the spirit. You know, us female nerds, we have to stick together, you know? So my first question for today is, what is your definition of scientific innovation?
So to me, scientific innovation is obviously scientific. So something in the field of science, but science, you know, can be medicine. Science can be at the cellular level. Science can be at biochemical level. Mm-hmm. So anything that fits in there. And then innovation is something new and hopefully something that contributes to the world. And I think also implied is with the intent to make things better. And so it can be simply Pandia Health, which is a service, but it brings birth control to wherever you have internet and a mailbox with the purpose of making sure no woman has to worry in the back of her mind every single month about running out of medication, or also educating women with a radical new idea, which is called my moonshot. I took that from TEDx Berkeley. If you have a uterus and you're bleeding 1 week out of 4, we want you to know it's optional. And how much better is life without random blood 1 week out of 4 for 40 years of your life? And if you decrease the frequency of that or turn it off, you can decrease endometrial, ovarian, and colorectal cancer. You can decrease your risk of anemia. And then you can increase those with uteruses productivity in school and work and society, because it's the #1 cause of missed school and work in anyone with a uterus under the age of 25. And you can also decrease landfill, because we use 10,000 to 13,000 menstrual products in our lifetime. And if we could cut that down to 1/3, how much landfill would we save, and money and stress?
See, I've always believed that women's rights are human rights. And I
love that.
No, absolutely. And I was born in West Africa, and it's good to see companies like yours that are helping women to make a decision, as you say, making women's lives easier, and for them to also decide, it's a choice, what they want to do each month it is their decision at the end of the day. I don't know why that is so controversial around women's rights.
Yes, I think if we flipped it and said you as a non-woman had to carry a baby to term, or you just had to have babies whenever I told you to, it would have been a right all along. But I feel so often we as women suck it up. And we don't talk about how horrible periods are. The other side really doesn't understand. And I actually want to have a period awareness month where any allies of women wear a little sticker on their shoulder. And then we as women randomly can take a water balloon with red ink and throw it at them. And then continue that randomly for the next 5 days, just so they know what it's like. Because that happens to us every month for 40 years of our lives. And we just suck it up, you know? Right. And same thing with menopause. We're looking, Pandia Health, to build the brand that women trust from birth control, but grow with women as they grow. And all my friends want menopause. And I didn't realize till I started looking at menopause, it's not covered by insurance. And that's ridiculous. It affects your life. It's a health problem. I need medications. Why should I have to pay for it? You know, I'm going to be better if I'm better. I will contribute more to society if I don't have hot flashes, or I don't have pain, or, you know, other issues. And it's because we as women don't talk about it. We just suck it up. We suffer. We don't, and we need to talk about it. We need to ask for research. We need to advocate that this stuff is covered by insurance. We must no longer suffer silently. I completely agree. Now, I might guess it, but I just want to hear it from you. What do you think is your most significant professional achievement? I mean, you've done a lot, obviously, very well educated, but I imagine that similar to people like me, where we measure ourselves based on impact. And so I'll be curious to know what is your most impactful professional achievement today? Yeah. So, you know, as you mentioned, I started as a physician, and that was me and my patients. Then I became a professor, because then I could teach the future doctors, this is how you take care of women. And by creating Pandia Health, I've helped any woman, anybody with a uterus in the United States who is on the birth control pill patch ring, never have to worry about running out of medication again, decreasing that pill anxiety. I've actually coined the term, as you get to that last week of pills, if you don't go to the pharmacy, it will be a horrible consequence. Pill anxiety. So decrease the level of pill anxiety in women's minds. And from this platform, I'm able to launch the concept of #periods optional. So I think that will be my final impact, that if I can get it out there, that everybody with a uterus and anybody who's a friend of a uterus, so hopefully, I like to say, we all came of a uterus. So respect the uterus. So everyone should be friend of the uterus, otherwise you wouldn't exist. And so if all those people know that you don't need to bleed every month, that is not critical, and that would so much improve people's lives, that I think would be my greatest contribution to the world, and would be huge. Wonderful. Very, very well said. Now, I listened to your recent TEDx Berkeley event, and your passion for Pandia Health, inclusive of #periods optional, and destigmatizing birth control and promoting hormonal birth control treatments, it's very clear. What is your inspiration? My inspiration is both selfish, and also I have 2 daughters. So the inspiration, as I mentioned in my TEDx talk, I had the realization when I was trying to get pregnant that the only reason those with uteruses build that lining every month is to build a beautiful, rich lining to support an embryo for the next 9 months. And unfortunately, in the modernized world, we start doing that at age 12, and we don't have a child until 26, or for those of us with more education, 35, or if, you know, it took us a while to find our significant other, and that's 20 years of every month building that lining, no embryo, blood, and just the looking back. I want anybody with a uterus to be equal. So it is about equality. I was in the middle of a biochemistry test and at MIT, pre-med, and then all of a sudden, blood. And do I run to the bathroom or do I stay and finish the exam? And being a pre-med, I stayed and finished the exam. But was I a little distracted? Yes, I was. And I looked to my left, I looked to my right, being MIT. Man, were they distracted? Are they distracted every single month for, from age 12 to 26? Not saying that women are inferior, saying that we can do everything they do, bleeding 1 week out of 4. But if it's not necessary, why are we doing this? And so that's what really brought this to me. The other thing is, as you said, women's rights are human rights, and we are not equal if we can't control when and how many children we have. If I got pregnant, I should have the ability to decide what happens, but also I should have the ability to prevent pregnancy. If my parent says you can't have birth control, then I'll end up pregnant. So, and then I won't get to medical school, and then I won't get to my future. And so that is the inspiration, is my rights, but also my daughter's rights. And then all of womanhood, all of uterus's right to be equal. That is what drives me. That is what inspires me.
I love that. And now, just if you think as honestly as possible, how close do you think you are to achieving your company's mission, your vision for Pandia Health in terms of destigmatizing birth control? You think we're 5 years away, 1 year away, or we might never actually get there?
I never say never, because I would not set myself up for failure. I think that we can get there. Absolutely. I being, in the startup world, every month is a year, every year is a decade. And so I like things done tomorrow. I know it won't be done tomorrow. I think realistically, maybe 4 years, just because that's how long it takes to get a new president and have them in and do some good. Maybe 5 years, because 5 is a good number. And as Asians, Chinese, we don't like the number 4. So maybe 5. But I think it's definitely doable. And I think given the Women's March immediately after the election in 2016, and given Ruth Bader Ginsburg's passing, there's a lot of awareness about women, hopefully, and women's rights. And we have a generation of allies. I feel that those 40 and under are, my husband's 50 and under are very supportive of us as those with uterus. And there's still the other side, but I would say, we keep saying, we hope the old ones who are stuck in their old ways, the old sexist models, will pass on and leave it for those of us who believe in equality, who do equality. I mean, what makes me what I am is my amazing significant other that is willing to take on the child duties that I made it. My tip to those with uteruses is, when you have a baby, if you're doing input, you don't do output. The other side does output. So I did breastfeeding and he did diapers. I did not do a single diaper until he could do breastfeeding, which is a bottle, right? And it makes it clear from the beginning that this is our baby, that it is 50-50. It is not all me doing everything. It's half your baby too. And I already took on the burden of growing it for 9 months. And now I have to feed it from my body every 2 to 3 hours for 3 to 6 months in a row. The very least you could do is change the diaper. And so setting the equality as soon as that baby comes out is very important.
I love what you said. You give practical examples and you draw from your own personal life. And I think that is very powerful. But I want to go back to something you said earlier. You mentioned roughly 5 years. But do you actually believe we'll ever get to a point where worldwide, not just here in the US, but worldwide, birth control is not such a controversial topic?
I think the key is to rename it. And so me and my endocrinologist friend, we want to change it from oral contraceptive pill, OCP, to EPP, because we already have the term in medicine, POP, progesterone only pill. Doesn't say anything about birth control. It just says progesterone and it's a pill. And so the standard birth control pill is estrogen progesterone pill. So it should be EPP and not OCP, which is oral contraceptive pill. And as we know, 70% of women that use the oral contraceptive pill are using it for non-oral contraception. And if we make it about controlling the bleeding, allowing women a level playing field when it comes to school, so that when she's taking a test, she won't be distracted by random blood. When she's running a marathon, she won't get hit by blood trailing down her leg. When she's in the army and there are hound dogs sniffing you out, she's got blood and the dude doesn't have blood. They're gonna find her. Right? So it's making it about equality, making it not about birth control, but simply a hormonal option, a hormonal treatment, making it about women's empowerment. I think you're right. On the world level, that will take 10, 15 years probably, but I'm seeing more progress in other countries. The US is going backwards and more, quote, conservative countries are going forward. More conservative countries have had women leaders, but just because they're women doesn't mean that they're friendly necessarily with women's rights. But we've seen amazing results with New Zealand, right? And Taiwan, and just these wonderful progressive women leaders, Germany, you know, but Africa is where we need to see more. And I've seen, you know, African women take the lead. I love that there was a sex strike. I think that's the way it should be.
There you go.
No one should have sex with anyone who goes against your rights. And if we all withheld sex from those who are anti-women, anti-birth control, they won't have any babies. They can't vote once they don't reproduce, but they'll also be very sad.
I know, but such is life, as they would say. And so, you know, education plays a very important role in breaking some of these barriers. And I'm curious to know, what commitment does Pandia Health have to educate? And you're doing this, obviously, by participating in this podcast, but tell me more what you're doing to educate.
Absolutely. If you compare us to our competitors out there, we are the only women-founded, women-led, the only doctor-founded, doctor-led, doctor-founded, there are some doctor-led, and the only academic doctor-founded and led company in this space, and possibly out of the health tech company. Somebody put on Twitter, are there any female doctor-led healthcare companies that are doing well? And there aren't that many. And obviously we came up. And so, as I like to say, I live, breathe, eat, and prescribe birth control. So I can talk about birth control all the time. And I love to do that. And I love to educate. I come from, you know, the academic, teaching other people in medicine, see one, teach one, do one. And so I'm always about teaching so that you can do it, you know? And so we have Facebook, we have Instagram, we have YouTube, but I would say, sorry, I should have led with YouTube. So go to YouTube. We have a ton of free videos. The beauty of YouTube is they can translate it in like 30 different languages with the captions. And, a ton of information on the birth control pill, patch, ring, on periods optional, on the first time starting your pill. Does it make you gain weight? No, it doesn't. Does it make your acne better? Yes, it does. You know, all these little things. And then if you have any questions, hit us up on YouTube, hit us up on Facebook. I also go to Quora. I'm a top writer on Quora, answering random questions about birth control and periods all the time. And Reddit, I've been on as well, though, just so you know, when I did it, Ask Me Anything on Reddit, it was horrible, the male trolls. And I'm like, I'm a physician, and I'm talking about birth control here. I was just so angry. And in that way, my husband failed me. I was like, you need to go on Reddit, you need to find this guy, and you need to take him down. And my husband's like, no, dear. And I was like, this is just wrong.
Yeah, but that's ignorance. And that's why I'd asked you about education, because really only through persistence and clarity in our messaging, with the credibility of people like yourself, can we begin to shape that narrative. Yes. So my next question for you, it's a bit more philosophical. So if you look at the biotech industry for the past, I would say 15 years, can you tell me what you've liked, the things that have stood out in a positive way, as well as some loopholes that you've seen in the past 15 years or so?
Yes. I think the two products that come to mind that I really like is one of my friends, Lioness, has the most Internet of Things vibrator. So it makes sense that, you know, we're looking at our heart rate, we're looking at our oxygen, we're looking at our EKG. And so she has a vibrator that can tell you the strength, the depth, the, you know, amount of contractions. But I also like is she turned it into graphs like Georgia O'Keeffe graphs. So you can have a colorful thing of the frequency of your orgasm, the strength of your orgasm, the different pelvic muscles that are going on during your orgasm. So I just thought that is the coolest technology out there. Another one that I really liked, and I learned trying to get pregnant, you know, these pregnancy tests, they're ridiculously expensive and they're not ecological. So, you know, one thing is like $26 and it comes in a box and it has this giant plastic thing. But when I was trying to get pregnant, my dad, the chemist, had a chemist friend and he's like, you can just buy a bottle of LH strips for like 50 cents each. And I was like, yes. And, you know, that's what we do in our clinic. When we have a patient pee on a thing and we check their specific gravity, it's just a chemistry strip. You know, we've all maybe done it in chemistry class, right? For 50 cents. And so what I've seen is that, but also Leah Diagnostics. I just went to check their website today. I was like, are you out yet? Is it for sale? And they have a more green birth control, pregnancy test that you can flush and that is biodegradable and compostable. So you don't have this horrible box and it's still a little large, but maybe that's what the technology requires. So I think that is really interesting. The things that concern me, and it's, you know, I haven't looked at their technology, so please forgive me, these companies, but looking at your menstrual blood, you know, and trying to get information from that, I'm a little concerned because it's not the same as your venous blood, right? I mean, there's probably stuff you could get in there, but like, you could try to glean information from that. The other thing specifically with telemedicine, I'm very concerned that, you know, the 20-somethings just want something fast and quick, and they don't realize this is your health we're talking about. If you went to your doctor's office, would you want like the fastest doctor possible? No, you would want the one that sat there and asked all the questions and listened to your heart and lungs and ears and as many body parts as possible to try to catch everything possible. So one, don't go with the quickest possible. Two, cheapest, maybe cheapest for a reason. And three, transparency. Go to these websites. Do they list their physicians? I can't find the CEO of some of these companies. Why are they hiding, right? I can't find their doctor. They'll list the first name, but they won't list the last name. What are you embarrassed about that you don't list the last name of your physician? We proudly list first, last name, all the degrees, where they went to medical school, where they went to residency, because we have high quality physicians. We have experts. Do you want an eye doctor running your birth control company? Do you want a non-doctor running your birth control company? And then also for people to know that just because you have a chief medical officer doesn't mean that they've checked what's happening day to day. And they might have signed off on this protocol, but has the protocol been mutated by marketing or by financial interests? And that these companies need to separate their financial interest from telemedicine. Because when you have the word medicine, we have taken the Hippocratic Oath, do no harm. And we have certain ethical principles, which is tell the patient all their options, let them choose, not just offer them the one that makes you money. Don't just push a particular one. So check that out when you're comparing birth control companies, but to give you all the options. Because as a doctor, I can write whatever you want and send it to whatever pharmacies you want. As a pharmacy, I can only fill the ones that I make money, but I should, as a doctor side, send it to whichever one. I shouldn't just offer the ones that make you money. And that's the difference between doctor-founded, doctor-led, than MBA-led or profit-focus-led company.
Great. I mean, credibility matters. And I think that that's an important point that we've sort of reinforced over the course of our conversation. Now, I'm curious to know, how have you been impacted, your business, by COVID-19? And even thinking about women's health at large, not just at Pandia Health, but how do you think that, you know, the companies and the industry, the women's health space, how has it been impacted by COVID?
The beautiful thing about COVID is that it has educated people about telemedicine. Physicians did not want to go into telemedicine. They did not feel it was safe. And I feel there are times where telemedicine is appropriate and when it's not appropriate. And for a talking follow-up, you know, nutrition, psychiatry, psychology, acne, where I can see your skin, birth control, which should be over the counter, menopause, which is doable, anything you don't need a lab test, or I don't need to listen to your heart or lungs, it's fine. And so that has been the beauty of COVID, is the quick adoption of telemedicine. The negative is that, again, because we're the only doctor-led company in this space, we will always tell you what's best for your health, even if it doesn't benefit my bottom line, because I will make money, but I don't need to make it off pushing something that's inferior or hiding information from you. So if you ask me what's the best birth control, IUD with hormone or implant, can I give you that? No. You need to go in person to get it. And so that has been the negative of COVID, is if women want the IUD or the implant, they've been afraid to go into the clinic, or they don't want to go into the clinic. And so I think for women's health, the negative is not being able to go in if you need a pap smear, not being able to go in if you have a sexually transmitted infection, though that can be done at home, etc. But it may not be as a good sample as if you went in and the doctor took the sample, or, you know, etc. So it has been a barrier, and more so not COVID, but really in the United States, our current administration has just been devastating to women's rights. And they're considering a Supreme Court justice who believes that a woman should be subjected to her husband's decisions. And that is just crazy and backwards. We are a human being. We have bodily and should have bodily autonomy. We are at least our husband's equals.
Yeah, we make up, what, 51% of the population, and it's time for the voice to be amplified. And you've done a really good job of talking about the space from a macro view. You've talked about companies that you find exciting, technology that you find exciting, companies that you're sort of wary of, but you know, that's the beauty of talking to you, your absolute honesty. Now, I'm curious to know, what do you think are some key consideration factors that will be important for sustaining innovation in the life science industry at large?
I think that we really need to look at representation. Everywhere we go, I would like to see 50% women, chair of every department, 50% women of every board. And I've seen them do that in countries, and I've seen them do that in governments. And if you're not at the table, then you're on the table, is what I've heard. You're on the menu, right? And just because my husband is an amazing ally, but has he ever breastfed? No. Has he ever had a period? No. Has his breast ever leaked during a meeting? No. And so these things aren't top of mind for him. So we need diversity in gender. We need diversity in ethnicity, because just because I'm an ally and I speak fluent Spanish, I don't know much, you know, not as much as someone who's lived that life. We need diversity in income. We can't just have all the rich, educated people. We need the perspective of the customer that we're serving and the person that we're serving. Because again, we live in our little bubble and we don't know the reality of that person that we're serving. And then age diversity. So I'm an adolescent medicine specialist, always thinking about teenagers and pediatricians where nobody speaks for them. And so to have a teenager represented when you're talking about teenager issues, to have a third or sixth grader, at least focus group or advisory group, if you're going to do something in that realm, you know, to get that, to get the diversity. So, and then of course, funding. Again, this administration has been horrific, cutting all of scientific funding, making all the scientists have no money to do their research and to consider going into industry. And that is only for profit and not for the sake of science, not necessarily for the sake of betterment of, you know, people's lives. So absolute commitment to public funding of research. And I used to be, you know, and I still am a little narrow-minded on the funding. Like, if I can't see the purpose, why are we funding it? But one of the greatest technologies has been PCR. And it was somebody studying bacteria in volcanoes. If I'd been on the NIH committee, would I have funded that? No, I'd be like, why do we care about bacteria and volcanoes? But without that, we wouldn't have PCR, which is huge in all of our tests and all of our research and everything. So we do need to fund the random, and it absolutely benefits us. And hopefully somebody with a bigger mind than me, but hopefully I've learned from that lesson that you got to try different things because you don't know what you'll find, and you don't know where your next amazing discovery will be.
Very well said. Now, my final question, the floor is completely yours. You have the right to say anything you want to say, any other commentary or thoughts, anything you forgot, anything you want to mention. Now is your turn.
Well, I so appreciate this opportunity. I so appreciate you. And I'm absolutely going to encourage everyone to watch all of your podcasts. And I hope that women will help women. When you are out there buying something, see who the owner is, see who the CEO is. And if you have two equal companies, pick the one run by a woman, please. And that women need to fund women. So know that there are organizations like SheEO, where you donate $1,100, they get it together with 500 people, then they give it to 5 women's companies every year. And they're doing it country by country. So if you want to start one of these groups in your country, just contact SheEO. And then there's Springboard Enterprise, which is amazing. It is an accelerator for women in all sorts of industries, and just a powerful women's network out of mainly the East Coast, but now they're spreading and they're moving into health tech. There's also Women's Startup Lab. I want to say a thank you to StartX, which is Stanford's incubator accelerator founders group. I want to thank Electus Capital, who has invested in Pandia Health, as well as Charles Hudson of Precursor Ventures, as well as his associate Sydney, for believing in us. And hopefully soon Jason Calacanis is putting us as part of his syndicate. And so I want to preemptively thank him as well. But know also, for anybody who has money, donor advised fund or nonprofit, you can put your money towards a targeted startup. So feel free to target any women-founded startups using your nonprofit money, using your tax-deductible funds. And I want everyone to go check out Pandia Health /periods optional and my TEDx talk on the bottom, and share with everyone in every language. And feel free to give the exact same talk in your language, in your ethnicity, wherever you are. Because the more people that hear that, I think it'll be a better world for those of us with uteri.
Well, thank you for empowering us today. I think I could speak with you all day, because you speak with passion, you speak with eloquence, and you speak with the tenacity that comes with your training and education today, because it takes a lot to go through that whole process. And now you're positively impacting lives all over the world. So thank you for being a guest today. And it's been an absolute pleasure.
It's been an honor, and you are an amazing host. You should be the next Oprah if you want to add that to your accomplishments, or the next #1 talk show host. We need more women talk show hosts.
Yes, there you go. Especially for science. It's not always the easiest topic to talk about, but this is our job to make science and healthcare fun. So thank you for your time. We'll connect again very soon.
Thank you so much.